And Michael Plank joins me now. Good afternoon to you.
Good afternoon.
Based on your COVID-19 modelling, a lockdown that extends to August the 24th is the best course of action in your view?
Yes, definitely the best course of action. I think the fact that we've seen cases in Wellington today shows that the virus has spread to other parts of the country. There's nothing particularly special about Wellington. It could easily be in other parts of New Zealand as well. Because we've only been in the lockdown for 3 days, people could still be in their incubation period at this stage. So it makes sense to extend the lockdown for a few more days, allow time for those people to develop symptoms and get tested.
And as you've said before, clearly this level of lockdown will be stopping the virus in its tracks. But when do you expect to see a byproduct of that, of the fact that the lockdown is in fact working?
Yeah, so it usually takes about 7 to 10 days for the effect of the lockdown to come through in the case numbers. So what that means is we should continue to see case numbers increase over the next few days. In a way, that's a good thing because it means we're finding the cases that are out there. It's a sign that our contact tracing system is doing its job. It's tracking down everyone who's been infected as part of this cluster. But then in around about a week's time, we should hopefully start to see that curve bend and the case numbers start to come down.
Michael, how problematic is it that a lot of the cases, the Delta cases that have been confirmed in Auckland, a lot of them are younger people? So does that make your modelling slightly more trickier because obviously younger people tend to travel more, they tend to go out more?
Yes, that's right. We know that that young people tend to have more contacts than people in older age groups, and so that means they're at a higher risk of transmitting the virus. And you can see that in the number of locations of interest that have come through. That very long list is indicative of that. That's definitely a risk factor that we could have been in a period of very rapid transmission prior to the lockdown on Tuesday.
Michael, I understand that the large number of cases is not necessarily indicative of how fast COVID-19 is spreading. Is that your view on things?
As I said earlier, what we're in now is a stage where we're really sort of putting together the pieces of the puzzle, and we're kind of playing catch up with the cases that were already there. So we're really sort of starting to build a picture of how the virus was spreading in the last week or two in the community. And so it won't be until we go into next week that we start to see the effect of that lockdown. And that's when we'll start to get a sense of, is that lockdown effective in slowing the transmission and then hopefully containing the outbreak?
Of course, many people are suggesting that perhaps because there have been cases now in Wellington, that perhaps is indicative that the virus is spreading. What is your current modelling saying about the current situation as it stands today, following this 3 p.m. press conference as to what we now know?
The news of cases in Wellington today is definitely significant. Because it shows that the outbreak isn't contained to Auckland, it has spread to other parts of the country. And as I said, I think there's, it's quite possible that it could be in other parts of New Zealand as well. So really, we have to wait and see over the next few days as to what the testing results bring. And the way that the government will start to build confidence that the outbreak is contained is if we continue to see high testing numbers across the country. And that we continue to find that when contacts are identified, they're already staying at home, they're already in their bubble, they're not out and about in the community. So that means, we can all play our part in keeping this lockdown as short as possible by sticking to our bubble. And if you have even mild symptoms, to make sure you get tested.
Michael, what's your view on the wastewater testing? I think yesterday the Ministry of Health said there was no signs in the Christchurch wastewater testing stations. Does that add another layer of confidence to your modelling, or is that just simply, it is what it is? It's something that you can add to the modelling, but it's neither here or there until you get more confirmed positive transmission cases in the South Island, if we do?
I think that is a good sign. And the way I think what that shows us is that we haven't got a very large outbreak of sort of over 100 cases. in different parts of the country. So it's definitely reassuring from that point of view. I think it rules out a large outbreak, but it may not rule out the fact that there could be isolated cases here and there around the country that we haven't found yet. And so that's why it's important to give ourselves the time for those cases to go through their incubation period while we're in lockdown, get tested before relaxing the alert level restrictions.